We embarked on this project because we had an opportunity to develop a population health tool that might support the improvement of care for people living with cancer. Because in the Cancer Alliance, we know that actually there's a huge unmet need for this group of people living in the community.
Population health management registries take integrated data from different areas across the electronic patient record, bring it together in one place, and then show the user the most important information. So the Cancer Care Registry is one of a number of registries that we have live in NCL at the moment. The registry extracts data from NHS providers in NCL on a daily basis and presents it in a really easy read format that shows, against evidence-based standards, what are the main gaps in care for that particular patient.
It's a pretty unique tool that we've not had, certainly for people living with cancer in primary care. It provides us with a way of seeing our cancer population as a whole. It helps us see where we might be missing some of the interventions we should be offering to our people living with cancer to make sure that they're receiving good quality personalised care.
It's been designed for primary care, so GPs or people charged with population health management. So there's two main ways to access the registry. You can go through a web browser. The other option is that if you're in EMIS Web, there is a widget for the London Care Record and you can log in through there. Once you've accessed, what you would see is your population in your practice, and you see all those key indicators. Amongst those indicators, what are met and what are not met. Much of this is reflected in the GP contracts, the QOF contracts, so cancer care reviews, cancer care plans, medication reviews. But what we've done in addition is really go beyond that and kind of understand this group of patients in their holistic terms, pulling in screening data, vaccination data, health promotion aspects of care, all the things that you probably would cover in a consultation. It just makes it much easier for people to have that overview of the patient group, but also as an individual level.
The HealtheIntent Cancer Registry is extremely visual, and I think that's one of its biggest strengths. Straight away, you see colour-coded boxes, headings for each parameter, and it very clearly gives you the percentage so you can see how you are doing as a practice as a whole. And then you're able to click on it and it shows you all your patients on the left-hand side, and it's very easy from that to generate a list of patients that you then need to target.
I think one of the really good examples is the Cancer Care Review. This is an intervention we should be offering to all patients that have had a cancer diagnosis at different points in their cancer pathway. And this dashboard offers us a really simple way, without having to go through individual notes or reliant on alerts from other IT systems, to see who's been offered and taken up a Cancer Care Review and who hasn't, and then to consider the reasons for that and then proactively reach out to those individuals. I think this is a really great opportunity to not only see who's had a cancer care review, but what's been covered as part of that cancer care review, and then some of the more, what might be seen as holistic elements like financial concerns, physical activity discussions, lifestyle interventions like stopping smoking. We can make sure that all these have been covered, and if the clinician hasn't done it as part of the cancer care review, that can be proactively followed up by some of the other fantastic members of our teams now, like social prescribers or link workers.
So a clinician doesn't have to remotely access lots of different records in different hospitals to see what's gone on with that patient.
It's very easy to see at a glance whether a patient's had their breast screening, bowel screening, cervical screening.
Tiles show red for a gap in care within a really easy read format, so the clinician has an opportunity to close those gaps in care.
And it's also particularly good for coding, because sometimes you may drill down on a parameter and then discover actually they have had that particular screening done, it just hasn't been coded properly.
Around 3/4 of people living with cancer will have at least one other long-term condition, and a tool like HealtheIntent can make sure that we're not duplicating conversations or offering unnecessary interventions to patients that they may have received for one of the other long-term conditions. For example, if somebody's got diabetes or ischemic heart disease, they may already have had conversations about physical activity, stop smoking interventions, and that should show up on the HealtheIntent dashboard. We don't need to reintroduce that conversation when we're doing a review about cancer.
With implementation, like with any novel tool, it's about trying to onboard the practice and make sure everyone kind of understands the key purpose, making that case for why this is helpful. So having a clinical lead is a good idea, but also having an administrative lead, because that links to the next aspect, which is the workflow and the administration that might come through some of the quality improvement work that you do as a result of implementing the registry.
It's a very good way to reduce health inequalities, and it enables us to see the variation quite easily and tackle it.
These tools are transformational. They bring data together, and that enables teams to come together. This information traditionally would take ages to produce. The fact that it's coming out every 24 hours and you can track your progress and adjust what you're doing is a real game changer for quality improvement within healthcare.